All right, let's talk about facet joint pain. So the facet joints, or facet joints, otherwise known as the zygapophyseal joints, are these tiny little joints that we see right about here at the back of the bony spinal column, okay? Now, just like any other joint in our body, sometimes, whether it's due to the wear and tear process with age, just like any other arthritic process, or potentially a trauma such as a car accident or fall, can cause these joints to become painful. Looking at the other side of the model here, this is the facet joint on the other side. This pink region is the facet joint capsule. These tiny little yellow lines that you see kind of woven into that joint capsule are what are called the medial branch nerves. So when the facet joints are painful, these medial branch nerves right here are going to be the nerves that pick up and transmit that pain signal. So that pain is going to travel from the facet joint through these nerves, eventually making its way to the spinal nerve, and then to the spinal cord, and then up to the brain, where we actually sense pain. So one of the ways we can treat facet joint pain from a procedural standpoint is to first do a diagnostic injection called a medial branch nerve block. So if I think that someone has pain coming from the facet joints, I can place a needle using precise guidance right near that nerve, the medial branch nerve, put a little numbing medicine on the nerve, which temporarily blocks the pain signal from traveling from the joint through these medial branch nerves and up the chain eventually to our brain. So we block the pain coming from the joints, and I tell patients, I want you to go walk around, move around, do some of the things that typically bother you, and keep track of how your back pain typically feels. And patients notice a significant benefit during the time period that the numbing medicine is working, with 2 rounds to really make sure that the pain is really coming from these particular joints. We can then consider doing what is called a radiofrequency ablation procedure, where once again we are placing needles right near those medial branch nerves. But rather than just numbing up the nerves temporarily, we actually warm up the needle tips, creating a little burn or singe or cauterization at those nerves, which disrupts the pathway for the pain to travel from the joint through these medial branch nerves to the other nerves, to the spinal cord, and up to the brain, so that we just don't feel the pain coming from these particular joints. Now that is more of the treatment part of all of this, and that's meant to last months and months and months and months at a time. If these nerves grow back over the period of 9, 12, 15, 18, 24 months or longer, we can always go back and redo the radiofrequency ablation to once again provide patients with a very long-lasting benefit. Okay. Other options for treatment of facet joint pain would be just doing a facet joint injection, where we place a needle right into that joint, and we put in a little numbing medicine and some steroid to hopefully calm the pain down that way. And lastly, we can also consider doing what's called a platelet-rich plasma, or a PRP injection, where we use a different substance and we place that right into the joint to help calm that pain down as well.